and canola 50 cents to over $6 higher. May up $5.50 at $787.80 per ton. New crop November up $3.90 at $619.80. Weekly grain handling statistics from the Canadian Grain Commission showed 240,000 tons of canola were exported during the last week of February. While exports were down slightly on the week, crop year-to-date exports of nearly 7 million tons remained well ahead of last year's pace, and movement will need to slow down or the country could run out of canola. Early gains in Chicago soybeans and soy oil provided spillover support for the Canadian oilseed as well, although as did the Canadian dollar, which is slightly softer this morning. However, scale-up farmer hedges and ideas canola is looking overpriced at current levels did temper the advances slightly. In the U.S., soybeans and corn futures are higher, while wheat is mixed. Soybeans up 13 cents in the May contract at $14.24 per bushel. Wet weather in Brazil continues to cause harvest delays for that country's soybean crop, while dryness in Argentina is raising concerns over yield losses there. With no substantial precipitation in the forecast for the next week to 10 days, that moisture deficit in Argentina could lead to sizable declines in the country's production. However, soft U.S. export sales did keep a lid on the upside. Corn, it found spillover support from the gains in beans, also watching South American weather. The May corn contract up 7 cents at $5.39 per bushel. The rain delaying the soybean harvest in Brazil is also keeping farmers from seeding their second corn crop, which goes in the ground after the beans come off. Positioning ahead of next week's monthly supply-demand report from the USDA accounted for some of the activity as well. Wheat, meanwhile, is mixed. While the gains in soybeans and corn provided spillover support, improving world winter wheat production estimates weighed a bit on prices. Minneapolis spring wheat up 2 cents in the May contract at $6.45 per bushel. Kansas City up a penny in May at $6.22 per bushel. And Chicago wheat also up a penny in the May contract at $6.52 per bushel. Favorable winter conditions in Russia and Ukraine should help wheat crops there, as they will soon be exiting dormancy. Better forecasts for the U.S. plains were also a bit bearish. That's a look at the ICE futures and U.S. markets for Friday, March 5th. In Winnipeg, for Markets Farm, I'm Phil Franz Workington.
New Holland Dealer Days are back. Butler Farm Equipment in Fort St. John is here to help you tackle the season ahead. Special preseason savings are available, featuring 0% financing and cashback offers on select New Holland hay tools, tractors, and material handling equipment. Thinking about trading in? New Holland Dealer Days is the time. Stop by Butler Farm Equipment in Fort St. John today to learn all about the preseason savings going on.
For commercial use only, customer participation subject to credit qualification and CNH Industrial Capital Canada Limited approval. Standard terms, conditions, and other restrictions apply. A down payment may be required.
The opinions expressed during this show do not represent those of this station. If you've missed any of this show, you can follow the podcast at energeticcity.ca. Now, an in-depth look at the news and information shaping our community. This is Moose Talks with your host, Doug Craig, on Moose FM.
Hello and welcome to another episode of Moose Talks. A little later on, we'll be chatting with Kylah Bryde, the Parks Manager with the City of Fort St. John, all about that pesky black knot fungus that has affected trees around town and how they want you to help them get rid of it. But first, it's just about a year since COVID-19 was declared a pandemic, a little more, or a little less than a year, I should say, since a lot of us started working from home to keep safe, and vaccines are rolling out gradually across the province. So, to chat about that and other health topics, we're joined now by Eryn Collins with Northern Health. Good morning, Eryn. Welcome to Moose Talks.
Good morning, Dov. Thanks for having me.
You're very welcome. Let's start with COVID-19. And, you know, we've been getting used to these, you know, for a while it was daily numbers from Dr. Bonnie Henry, kind of all these sources of information about how COVID is faring throughout the province. You know, we're kind of inundated with it at times, it feels like. Why don't we talk about the Northeast specifically, though? How are we faring in terms of, even in relation to the rest of the province?
For sure. I think the North in general continues, unfortunately, to see higher numbers of late than we did earlier on in the pandemic. We have a somewhat higher positivity rate for the test results for cases and ongoing activity in terms of new cases. Some recent numbers, and there's really good and very easy to view and see and understand maps on the BC Centre for Disease Control website that give a really good sense of what the most recent activity has been in any given area. Took a look at it this morning, and the most recent map that is up for the health service delivery area overall, so that's all of the Northeast, up to February 25th, there had been 1,023 cases in the Northeast in total. And they also report by local health area, so that breaks it down a little bit narrower. There had been 50 new cases in the overall HSDA reported in the week between February 19th and 25th. For about the same time period, those maps differ a little bit in terms of the weeks that they look at, but by local health area for about that same time period, there were just over 20 new cases in Peace River North and just over 30 in Peace River South. But on a positive note, there were no cases reported in that week in the Fort Nelson area, so that's good. Overall in the North right now, we have about 250 active cases of COVID-19.
Okay. From a PR standpoint, because you are with the communications kind of branch of Northern Health, anytime we do a story on Energetic City about COVID-19. I'm sure we might even get comments on this video as the show goes on. There's lots of people who think, it's a bunch of hooey. They have problems. Everybody has something to say about it. How hard has it been from a PR standpoint to sort of, persuade people that this is a real thing that's happening, that the social distancing measures need to be taken seriously, and vaccines also need to be taken seriously?
It's been a challenge, Dub, but from the beginning, largely just the volume of information that not only that we've had to offer, but that people are looking for to really make up their minds about how they feel about the pandemic in general, the measures that are in place and that are recommended for trying to protect yourself from the spread of illness. It has been a challenge. It's a lot of information and people have a lot of questions. I think what we've tried to do primarily is to point people to really credible sources of information. I think the province has done a good job of having that information available on the provincial websites. We've done a ton of work in terms of talking both to local media so that we can talk to communities about what's happening in their area, but on our website as well. Now with the vaccine rollout, there's a whole new set of questions and information that needs to be shared and that we need to make sure gets out to the public.
Are you expecting things to get more or less difficult, kind of as we move into summer, more people are vaccinated and, seemingly we're expecting cases to go down?
I think that's the general expectation and the very strong hope at every level is that we've, through the public health measures that have been in place, I think BC overall, and Dr. Henry talks about this a lot in terms of BC's pandemic and how that has evolved over time. The really big goal has always been to keep the healthcare system from becoming so overwhelmed that people couldn't get the care they need when they need it. And so the goal was never and wouldn't have been realistic to try to stop COVID completely in its tracks, but to make sure that people are armed with information and measures that they can take to help slow it, protect themselves from becoming ill. With the vaccines, I know that everyone in public health and everyone that I talk to in public health is very excited and very optimistic that the vaccine is going to have an impact. There's evidence that it has already with the immunizations that have been done in long-term care settings. It really did dramatically reduce the number of active outbreaks in facilities across the province and across our region as well. So I think the evidence is there that the vaccine is effective and is having some success in turning the tide and shifting those trends in case activity in the direction we'd really rather see them go.
All right, we're going to talk more about the vaccine in just a second, but I wanted to ask this. How concerned is Northern Health about the COVID variants? I think there's a couple of them now for sure. Is that something we really need to be concerned about at this point in the North or even in BC?
Well, they've called them variants of concern, so I think that's an indication that they are concerning. To my knowledge, we've not yet seen any confirmed variant cases in our region, but they absolutely are on the radar provincially because there have been confirmed cases when they do the sequencing and the further testing on samples and determined that some of the cases that are coming up positive are variant cases. The overall concern is that they are potentially more contagious and could take off and spread more rapidly. But at this point, it doesn't change the public health advice in terms of protecting yourself from COVID-19, regardless of which strain it is at this point.
Okay. Any update on the outbreak that was happening at the Dawson Creek Hospital? Do we have any more word on how that's going, or if it's close to over at this point?
It's largely stabilized. There's not been much movement in terms of case counts in recent days. Outbreak declarations and the measures that come along with them remain in place for 2 COVID incubation periods after the last possible exposure to a confirmed case. So we're now in that period of monitoring for any additional cases, keeping the outbreak measures in place as a precaution. And I'm not sure what the potential end date is based on that math. I'm not real great at math, but it is stable, and we're not continuing to see new cases in either patients or staff.
Okay, doke. Let's go back to vaccines then, shall we? We're wrapping up phase 1, as I understand, of sort of the rollout. So phase 2 will be beginning shortly. Can you give us kind of a general breakdown of who's going to be getting the vaccine in phase 2 then in BC and in the Northeast?
Definitely. Phase 2 is underway now.
Okay.
Earlier this week, we started, along with other health authorities, contacting people who are living and working in independent living centers and senior supportive housing, long-term home support clients, and their staff to book those appointments. And that work is very much underway. Then there's seniors in the community who very shortly, Monday in fact, are going to be able to call in the weeks ahead based on when they're eligible, and that's by a date range for their age. And so the exact date someone can call in to book an appointment depends on how old they are. And we'll be starting booking appointments next week for seniors aged 80 plus and Indigenous peoples aged 65 plus. Those are people who are in the community, not living in a housing sort of situation. So we have one number across the health authority that people can call to book their appointments. What we're really encouraging people to do is to keep an eye on our website in particular, because there are some variations in terms of that staggered schedule for the North, simply because of our smaller populations of certain demographics. So we'll have really clear information on our website. Some of that is already up, in fact, and you can look by community in terms of when your eligibility period starts. So for Dawson Creek and area, for example, Dawson Creek will be booking anyone over the age of 80 plus following this schedule. And so seniors born in or before 1931, so 90 years or older, will be able to call starting March 8th. We're going to shift into seniors 80 plus fairly quickly after that. And so those seniors will be able to call in starting on March 10th next week. The other thing we're really encouraging people to do is to wait for their eligibility group before they start to call. Calling sooner will not get a vaccine appointment sooner. It may prevent the people who are in the eligibility group from making their appointments, and folks who are calling outside of their eligibility period will be asked to call back.
Okay, good information. I guess that means since phase 2 has started, as you said, we're pretty well on track kind of with the original plan that the BC government released for the phased rollout, aren't we?
We are, and so we're already working to finish off those phase 1 groups for anyone who may not have been able to be vaccinated at that time or wasn't available at that time. The other key thing to remember too is that you don't have to call exactly when you become eligible and fear that you're going to miss out. Once you are eligible, whether it's in this phase 2 rollout or going forward in phases 3 and 4, once you're eligible, you remain eligible. So if you're not in a position to call or to have an appointment immediately when your eligibility group opens up, that's not a cause for concern, because your eligibility will never expire, I think is probably the easiest way to explain it.
Okay, and finally, I wanted to touch on the flu for a bit. I know I've just noticed since the start of the pandemic, I haven't really had a cold. I certainly didn't get the flu. Flu has basically been non-existent in BC this season, which is amazing. I don't know that anybody really expected that. How have been things in the Northeast for the flu? It doesn't seem like anybody's getting it.
The Northeast is, as far as I can tell, no different than any other areas of BC. The BC Centre for Disease Control every year does surveillance on an ongoing basis through the year, through the flu season, for flu activity in the province and in our region as well. And you can see that information on the BC Centre for Disease Control website on a weekly basis. They tend to post surveillance reports. I checked the latest one this morning, and since the beginning of September of last year through to February 27th, which was only last week, there have been no influenza cases detected in BC. That's not because they're not looking. There have been more than 50,000 specimens that have undergone testing for the virus, and there really is no indication that there's flu activity taking place in BC. I've asked about it myself of some of our public health folks, and anecdotally, I'm hearing that some of the contributing factors to that are really simply that COVID is the virus that is circulating in the province and elsewhere. But of course, most of us are taking prevention measures, more prevention measures, or taking them more seriously against COVID, and that by default serves to prevent other illnesses.
So the social distancing, the mask wearing, preventing flu as well, essentially. Washing
your hands.
Yeah.
I think a lot more people are paying attention to and diligently doing that. So it's another sign that the public health measures, what we've known all along in healthcare and elsewhere, is that there are infection control measures that you can take that help prevent you and others from becoming ill. And so I think that's at least partially perhaps what we're seeing with the lack of flu activity in BC.
All right. Always wash your hands. Always good advice. Eryn, thank you so much for taking a few minutes to talk to us today. I really appreciate it.
Anytime, Dov. It's been fun. Thanks.
Absolutely. That's Eryn Collins with Northern Health. We'll be back to talk with Kylah Bryde, the Parks Manager with the City of Fort St. John, right after this on Moose Talks.
Show your pug's personality, your terrier's true colors, your poodle's poof. At Friendly Pets, your furry little friends will love being groomed by their experienced groomers, Brandy and Ayla. Friendly Pets provides a stress-free environment with open concept grooming so you can watch the whole process. And they love being creative, so go ahead, give your Pomeranian a pink tail. They'll love it. Friendly Pets, where best friends are made, on 99th Avenue in Fort St. John and at friendlypets.ca.
Kindergarten registration in School District 60 for children who will be 5 years old by December 31st of this year is now available. Early registration will make sure seats are available in your home school and give you access to Welcome to Kindergarten programming opportunities. Play-based learning with BC certified teachers in kindergarten helps children with their social emotional learning, fine and gross motor development, speech, reading, and more. You can register online or call your school to schedule an in-person appointment. prn.bc.ca for more information.
You think a four-leaf clover is a find? It's your lucky day if you visit Sean Sargent Toyota. It's time to Toyota with rates as low as 0% or up to $5,000 cash back on select Toyotas. Get a free Dream Home ticket with your purchase and you may win a pot of gold. 2,500 loonies. Our indoor showrooms open till 8 p.m. weekdays, Sundays noon to 4, or 24/7 at sargenttoyota.com. But it all ends St. Patty's Day at 8 p.m. at Sean Patrick Sargent Toyota on the Bypass, Grand Prairie, or sargenttoyota.com. It's time to Toyota.
Here in the Peace, we get our fair share of snow. So, the City of Fort St. John would like to remind residents to keep their sidewalks clear for the safety of everyone. Property owners must clear their sidewalks of snow and ice within 48 hours of the last snowfall event. Let's come together as a community and make sure we do our part to keep our friends and neighbors safe this winter. To report a problem, call 311 or use the Report a Problem form on the city's website at fortstjohn.ca.
Have your eyeglasses or sunglasses seen better days? Then it's time to visit Merwin Optical, your one-stop shop for all your eyewear needs. Glenn and Sneehall are there to help you choose exciting new styles from Oakley, Ray-Ban, Calvin Klein, and others. Their expert advice can help you choose the right frames and lenses to help you look your best and see your best. Second sets are always half price. Same-day site testing for adults 19 to 64 only, and direct billing to most insurance companies. Visit Merwin Optical, serving Fort St. John since 1987.
A dynamic growing company in Fort St. John is now hiring. Complete Safety Services is currently looking for traffic control personnel and level 3 medics to join their team. Complete Safety Services strive to offer the best safety service in Fort St. John and area, and they encourage interested individuals to apply by sending a resume to careers@completesafety.ca. Complete Safety Services, now hiring traffic control personnel and Level 3 medics. To learn more, see them at their new facility on 7819 93rd Street or visit completesafety.ca.
Watch this show live on Facebook or download the podcast at energeticcity.ca.
Welcome back to Moose Talks. I'm Dub Craig. Now we're going to talk about Black Knott. Maybe you've gotten a flyer in your mailbox talking about it. Maybe you've seen the posts on the City of Fort St. John's Facebook page about it. We want to find out more about what it is and why it matters. So to do so, we're going to talk with Kylah Bryde with the City of Fort St. John. She is the Parks Manager. Kylah, thank you so much for being on the show with us today.
Yeah, no problem.
All right, so why don't we start with Black Knott? What exactly is it, and why does it matter?
So Black Knott is a fungus. It's really apparent in the wintertime, and it looks like that tar stuck to the branches. That's actually Black Knott. So it's a really disgusting-looking fungus in all of our trees, our cherry and plum trees mostly in town.
Oh, okay. So it's affecting specifically cherry and plum trees. Is that the only kind of trees it affects, or are those the only kinds we have in town that it can affect?
That's what we're seeing in town. It can go to other species, but pretty much it's the Prunus genus. So that's like our maydays, our sherberts, and our choke cherries.
Is there concern that it might infect other trees around town?
There's always the possibility that it can go more into our rose family, but we're not seeing that right now, and it's been in town for quite a few years.
Okay. And what happens to a tree if you just kind of leave it alone and don't do anything about it?
So what happens is this Black Knott fungus, it's really apparent on the outside, but then it's also in the branches and gets into the trunk, and so it stunts the growth. Things don't grow quite as well, and then it will eventually kill off our tree. So if you leave it, it will not take care of itself.
Okay, and I mean, out of curiosity, do you know how long like that a tree can live with Black Knott before it kills it off?
Well, it all depends on like environmental conditions as well. If it's in like the leader of the main branch or the trunk, then you probably would see a demise much faster. In early growth, it goes to like the new growth on the outside. So if you prune that off, it would just have much better survival rate. But as soon as it gets into the integral parts of your tree, that's when things aren't going to go well for that tree anymore.
Okay, and you said it's a fungus. So is it like a spore that like travels from tree to tree, or are they bringing it up through their root system?
No, so it travels, so it goes by spores. So that's why we're doing this whole program during the wintertime, because the trees are dormant. So if we can catch everything now and just get everything into a manageable level, when it starts to blossom in the springtime, that's when the spores become active. And it can go by wind, by rain, by animals. And so that's where they travel far distances. And it can go over lots of places, right? So it doesn't know our municipal parks and our green spaces that we've been looking at. So that's why we've gone and put in this program for our public residents.
Do you know how many trees it's affected like in total in Fort St. John?
So in the fall, we did a snapshot of our residents in town, and it's roughly about 60%. But as we've opened our program, applications have been coming in fast and furious, so glad that the community is receptive to that to help us combat this.
Now, is that 60% of all trees in the community, or just as you said, the cherry and the plum trees?
Yeah, so just our cherries and plums. It's the Prunus genus variety.
I see, okay.
That species.
And then just out of curiosity, you know how many cherry and plum trees there are in total, again, as a percentage of all the trees in the community?
They're really popular because, of course, they're ornamental. They're really pretty. So there's quite a few in town. On our municipal property, we just did that urban forest strategy, and there's 750 on municipal areas. So it's a pretty large number in residential as well.
may. And once you remove it, is it something that the tree can get again, or is it gone forever once you deal with it?
So if you prune out your tree, you have to then monitor for quite a few years afterwards, just always inspecting for like swollen branches. The tar-like substance that everyone sees in the wintertime, that's a mature state of it. An immature state would be just a swelling of a branch. It's kind of like an olive green color. It doesn't look as nasty as the black tar nodules on the trees. So that's where you really have to monitor every single year for sure.
Now, the program, which, as I understand, you sort of partnered with Shell Canada to kind of provide this service to come and take care of it for people who have these trees on their property, essentially. Is it possible for somebody to remove it themselves, as you say? Like, is that, or is it better to maybe have you guys come do it for us?
Yeah, so in the fall, we put out some education pieces on a how-to video to prune it out yourself.
Okay.
And we fully recommend to do that. The key part is just disinfecting your tools between cuts and then also disposing it properly. So putting it in a plastic bag, putting it in a garbage can, just because the spores can remain active even after it's cut. So we definitely encourage residents to do that. When we were doing our assessment and just trying to see how bad things looked in town, that's where we decided to apply for some funding to give residents that don't maybe have the means to take out their trees or prune themselves. That's where we come in. That's what this new program.
All right, and I'm not the only person in town who happens to rent, their homestead, place of residence. So if I notice some black knot on trees, in and around my house that again I rent, should I go to my landlord or should I just contact the city directly and say, hey, I've noticed some? Can you come by and take care of it, please?
Yeah, there's kind of two different parts of that. Some trees are on city boulevards that can be a call to us, and then we can come in. We like to always give the homeowner notification. But then if it is on private property, we do need to get permission and waivers signed and things like that. So contacting your landlord if you know it's on your property, or you can give the city a call and we can tell you if it's on a city boulevard or in your property.
All right. Well, why don't you tell us about exactly how we go about it? You said we call the city, but there's a bit of an application process to have somebody come by, right?
Yeah, so everything's available on our website. So if you go to fortstjohn.ca and then Black Knot, that's where you'll find all the information on the how-to video to prune, and then it's also the application form, and then that starts the whole process. So even if you do call us, we'll be sending you to this application form as well. And then once those come in, we're trying to get them in a grouping. So once we have a few areas in one neighborhood, we'll go out and assess, and we'll plan the best approach for that specific tree. So it's not a remove, it's not a prune. We just have to go in and check right away. And then we put some flagging tape on, and then we contact the residents of the game plan. And then we just need some waivers signed, and then either city staff or a contractor will come in and take care of it for you.
All right, Kylah. Well, I really appreciate you taking some time today to come chat with us about this and help us say not today to Black Knot. Thanks so much for being here.
Thanks so much.
You're very welcome. That's Kylah Bryde, the Parks Manager with the City of Fort St. John. We'll be right back to wrap things up on Moose Talks right after this.
Upgrade your kitchen appliances and save with Brad's Furniture and Appliances. Buy more and save up to $300 on Maytag kitchen appliances. Save up to 35% on GE kitchen suites. Save an additional 10% when you buy 2 eligible Samsung built-in kitchen appliances, and save an additional 15% when you buy 3. Financing available. Brad's Furniture and Appliances. In the Northgate Mall and also on Facebook. Better call small.
At the YMCA, we continue to provide frontline pandemic supports to our community, including essential childcare, mental health services, and assistance to seniors. We believe that health is a right, not a privilege. We need your help now, more than ever. Ensure that our community continues to have the supports it needs to thrive. Visit nbc.ymca.ca and make a gift today.
If you're looking for hassle-free internet services, call the Peace Region Internet Society today. With coverage throughout most of the Peace, PRIS can get you connected quickly without the hassle of contracts or bundles. Visit PRIS.ca or call 1-800-768-3311 for more information.
This Sports Booster is brought to you by First Choice Towing. For all your towing needs, lockouts, boosters, tows, they do it all 24/7. Call 250-785-2271. You can count on First Choice Towing for all your towing needs.
Our community first. This is Moose Talks with Dub Craig on Moose FM.
Our thanks again to our guests, Eryn Collins from Northern Health and Kylah Bryde with the City of Fort St. John for joining us today. Remember to check out the 47th Annual CDC Talent Show tonight at 6. It'll be streamed live on the energeticcity.ca Facebook page or on the Moose FM page if you'd like. The event has gone virtual, but you'll still be able to donate to help the CDC buy all-terrain wheelchairs for their lending library by calling the number on the screen during the broadcast. If you want to donate now, though, you can call them at 250-785-3200. That does it for this episode. Moose Talks is produced by Adam Rayburn and Trey Lopashinsky. I'm Dub Craig. See ya.
Join us next Friday at 10 a.m. for another episode of Moose Talks, a weekly talk show about Fort St. John and the North Peace.
Energetic Country 100.1 Moose FM.